Thank you so much
Hello.
for being here and help me with this testimonial. It's gonna help a lot of people out there.
Totally. Happy to help.
What motivated you to look for the HMR method treatment?
For me, it was chronic pain that I've been dealing with for, I don't know, hard to do the math. Definitely. And it was chronic in my low back, in my torso, like the back of my torso, and in my hip, predominantly on one side, like on my left side. And nothing I tried for years and years ever brought me like lasting relief. So I was really looking for something different. I believe I was recommended to you by a naturopath that I was working with. So I was like, sure, I'll give it a try. Why not? I've tried so many other things. But yeah, it was chronic pain in those areas that really led me to try something new.
So those other treatments that you tried, what type of treatment was that?
Predominantly massage therapy. So I had a really wonderful massage therapist that I worked with for many years, and I really loved seeing her. Fortunately, she passed away, and then I moved north of San Francisco where I had been seeing her. So I was really in the market for a new body worker in general, and I had seen some up in Marin that again were massage therapists, but nobody really resonated with me, and nobody like really provided any lasting relief. So I would say massage therapy was like the number one treatment that I went back to time and again over the years. I also went to chiropractors off and on for decades. I would say that was probably like a couple of years at a time, and then I would take a break from chiropractic and then go back to it. And then acupuncture as well. I still love acupuncture, and I go to acupuncture for other reasons, but I never found it to be effective for me for pain management of my specific like pain issues.
So what was your initial thought after your first session with me?
Well, I mean, honestly, I was like, well, I hope that helps because it did not feel good.
Yeah, I know.
Yeah, it's definitely it's very intense work,
Hmm.
but I can say a lot of things about that. As you can probably imagine based on the way I've answered questions already, for many years received body work for it. So I'm pretty experienced with receiving body work and being a really good communicator about what feels good, what doesn't, where my boundaries are with like pain and all of that. So I had no qualms being honest with you. But what I noticed about this was that it was very different, right? It was very intense and very uncomfortable, but I could tell that it was very targeted and
Hmm.
specific. And the relationship with you from like the moment I started working with you was very comfortable, right? Like I felt very comfortable being honest with you, saying like, oh, that's too much, back off. And you are awesome. And you continue to be awesome at really listening to the feedback. And like, always feel fully heard, fully understood, fully listened to. And then really that gives the opportunity for the body, my body, to like relax into it and allow you as the therapist to do that deeper work that you need to do. It still might not feel very comfortable, but I am in a more regulated place where I can breathe through it and start to feel like the release happening, which is really powerful and really, I think, a special element of the treatment that I don't feel like I always got with other types of body work.
Hmm. Yeah, it's kind of tough when I'm working on probably for another few days after the treatment, right?
Mhm.
But gives you a long-term relief, right?
For sure, 100%. Yeah. And I really have always appreciated how from the beginning you shared like I mean, correct me if I'm wrong, if I'm saying it incorrectly, the idea that the work that you're doing is bringing that inflammation, which helps to heal,
To
for
heal
lack
over
of a better
time.
word, to heal over time.
Hmm.
And it's that positive kind of inflammation, not like the negative inflammation that we're always trying to avoid.
Hmm.
And so that idea of not using ibuprofen to deal with the discomfort for the next day or two after the treatment. And again, that was another thing besides just body work. That was another go-to for me, like constant use of ibuprofen to deal with my pain.
Hmm.
It's like, I mean, I maybe take that once a month now, if that.
But now
Um,
the way you used to, right?
yeah, not the way I used to. So yeah, I think just your explanation of how the technique worked
Hmm.
when we first met really, really helped.
Hmm. So, what stood out to you about the HMR treatment compared to the other type of body work that you had?
What stood out to me?
Yeah.
Well, that it's effective, that's for sure. I definitely, so I've been working with you for 2 years now.
Yeah, I
And the
was just
reason I
looking at
keep,
it.
yeah, it's all the
The
time, right?
date.
Yeah.
Yeah.
Yeah, actually, it's true. It's in March that I started
It
coming.
was the 29th of 2023 when I started.
Okay.
Yeah.
Yeah. Awesome. I mean, and yeah, the reason I come back now is not for that pain pattern anymore. Like that is honestly, it is completely gone. I don't know, you probably keep better records than I do, but I would say that resolved within 6 months, maybe
Mm-hmm.
less, I don't know. And the reason I keep coming back is because I'm a human. I have pain. Pain comes,
Mm-hmm.
pain goes.
Then
But I
goes.
know that like I can come to you like once a month and get the treatment that I need to help release whatever pain pattern my body might be holding on to because of life.
Mm-hmm. Yeah.
And I feel amazing for the next month. And the next month when I come, it's typically a new area that's bothering me.
Mm-hmm.
So I feel like that would be the number one thing that I noticed about this specific treatment, that it was effective, right? And really
Mm-hmm.
breaking up those chronic pain patterns that I was suffering from.
Mm-hmm.
Um,
Um,
yeah.
so, so was there a moment like after when we started? I don't know if it was the first, second session. Was there a moment where you say like, "Wow, this is really working"? When was
That's a
that?
good
Do you
question.
remember?
I know in the beginning I was coming weekly. So I would say maybe after the first month. It's hard for me to remember exactly, but I
Mm-hmm.
do remember it was relatively quickly. I don't think it was after the first session for sure, but after a few sessions, I could
Mm-hmm.
notice a difference. And I honestly think the reason why I noticed a difference was because when I came in for the session, you were continuing to work in the same area because it was a chronic issue
Exactly.
that was
Yeah.
still presenting itself, but you were able to work deeper and
Mm-hmm.
the experience was less intense and less
Mm-hmm.
uncomfortable for me.
Mm-hmm.
And then I started to notice, yeah, in the daily life as well, that my movement was better. Yeah, I remember actually like something that's really tricky for me
Uh-huh.
is like going downstairs. And I
Mm-hmm.
noticed like, oh, like that step down was like so much easier now.
Mm-hmm.
So yeah, I think those were the things that kind of let me know that I was
Mm-hmm.
doing better.
How treatment resolve your pain? How that impact your daily life?
I mean, it's like priceless. Like, honestly. I mean, to not have that pain anymore. It's funny. I was actually thinking about this when you asked me to do this chat with you. Um, I was reflecting on like that specific pain pattern and how it doesn't exist anymore. And it was so interesting to me that I hadn't thought about it in so long. And then it made me realize how much energy, like mental, physical,
Mm-hmm.
emotional, like all those different energies that were put towards that pain. And like now that it's not there anymore, like the freedom that I'm able to feel like on all of those different energetic levels is like truly amazing.
It's just very
Truly amazing.
powerful. Really,
Yeah,
really
very
cool.
powerful.
Right?
Yeah,
Yeah.
totally.
I have a question. So let's say for people, if you know someone who um, want to try but is kind of unsure because they never heard about the technique, um, what would you say to someone who is in that position right now?
Hmm. Well, I definitely would say give it a try, and you might not like it the first time because it's definitely uncomfortable. It's an acquired taste. um, but like I said earlier in our conversation, like I think that you have such a knack for putting your clients like at ease and really listening to them. So I think one of the things I would also say to a potential client is definitely try it again. But also communicate, right? When you're like in the session. Because I
That's
think a
very
lot of
important.
people, yeah, a
Yeah,
lot of people
yeah,
think like, oh, I don't want to like, yeah, I want to like tough it out or like, or if it hurts, that sometimes I think people think, oh, if it hurts, that's good. Like they're going deeper. And it's actually
yeah. It's
not beneficial.
counterproductive because,
Yeah,
yeah,
counterproductive.
I have to work and I need the muscle to be totally relaxed when I'm doing that.
Yeah.
That's why we need that communication.
Yeah.
It's gonna be uncomfortable, but cannot be unbearable, right?
Yes, exactly. That's a great
So
distinction.
we really need to to understand that. And when I'm working, we need that communication. Is that
Yeah.
a specific spot? Yeah, it is right there. So I can really work, even though it's gonna be kind of painful, but
Yeah.
doesn't mean I have to go really hard on that. We can go really light, and maybe
Yeah.
I can go a little deeper after a few minutes, or maybe you can leave for the next session. But we need to
Yeah.
know exactly those spots, and that communication is very important. It's very different than when you go to massage therapist where you can like
Yeah.
take your nap and the person
Yeah.
go and do the work. Over here
Yeah.
is totally different. We work as a team. I need your
Super
help.
collaborative. Yeah.
Very,
Yeah.
yes, it is.
Yeah. And that's, I personally really enjoy that. I was always
Hmm.
kind of a
Yeah,
talker
yeah.
during
Hmm.
massages,
No, it's
telling
great working with
people
you. Yeah.
with this, like, go there, do that.
Angela, so yeah, I want to thank you so much for being here, for helping with this. And it's
Yeah.
been a pleasure being with you for almost 2 years, right? In a
Yeah.
few weeks, it's going to be two
Amazing.
years. And
Aw,
I'm
special.
very happy that this technique and my work was able to make, is still making a difference in your life.
Thank you. Yes. I mean, such a difference. I really hope I put it into words.
You
And
did. And
yes,
it's
so
always good
appreciate you.
working with you. This
Yeah. Thank
communication
you.
that we just were talking about, you're very good at it. So yeah,
Yeah.
it makes my job
Thanks.
easier.
Oh, thank you. Thank you. And thank you for all that you do. So
No,
appreciative.
you're very welcome. Thank you so much.